Hello everyone, my name is Carla McKenzie and I'll be doing my presentation on HIV among youth. Just a quick icebreaker to get us started, we're going to talk about some myths and some facts as it relates to HIV. Myth 1. If I had HIV, I would feel sick. Fact, not necessarily. People can have HIV without symptoms for years. Even if a person with HIV feels good, the virus is still reproducing in the body. Myth 2. HIV only affects certain groups of people. Fact, anyone can get HIV, and you can become infected the first time you're exposed to the virus. HIV is spread through body fluids such as blood, semen, vaginal fluids, and breast milk. Oftentimes, youth may feel that HIV only affects MSM, which is men who have sex with men, or African Americans, whether it be male or female. And the fact is, HIV does not discriminate against race, sex, gender, sexual preference. Anyone who engages in unprotected sex can be exposed to HIV. My viral load is undetectable, so I cannot spread HIV. Fact. Yes, it is possible that you can still transmit HIV. However, having an undetectable viral load greatly lowers the chance of transmitting the virus to your sexual partners who are HIV negative. And I would like to point out a campaign, U equals U. It's untransmittable equals undetectable. And basically, it's a campaign for people to stay on their HIV regimen meds. So, for instance, if I was in a relationship with an HIV positive person and that person is staying on their medicine, it is less likely for them to transmit the virus if they adhere to their HIV regimen. Hence, undetectable equals untransmittable. So, some background. According to the Youth Risk Behavior Surveillance Report, shows that although overall students are making better decisions about their health, there are still too many students reporting high-risk sexual behaviors. Again, according to the CDC, 1 in 5 new HIV diagnoses were among young people aged 13 to 24 years old in the United States. 87% of youth who received an HIV diagnosis were young men, and 13% were young women. Only 9% of U.S. high school students have ever been tested for HIV. Condom use among sexually active students decreased from 62% in 2007 to 54% in 2017, presenting a serious health risk for HIV and STDs. HIV among young people in Texas. According to the Texas Department of State Health Services, there was a total of 985 HIV cases in 2017 for young people 10 to 24 years of age. And just a breakdown of that, 10 to 14-year-olds had 5 cases of HIV. 15 to 19-year-olds had 221 cases. 20 to 24-year-olds were presented with 759 cases of HIV in 2017 in Texas, bringing a total to 985 cases of HIV for young people 10 to 24 years of age. Now, what is important to note here is that these are only reported cases of HIV. Imagine those who may feel they may have HIV or have the symptoms of HIV and have not went and received a free HIV test to determine their status. Again, HIV among young people in Texas. On the left, there is a graph, and on the right, there is a chart. For men 10 to 14, there are 2 cases. 15 to 19-year-olds represented with 190 cases. 20 to 24-year-olds represented with 674 cases. And again, that's again for men or males. Women, 10 to 14 had 3 cases. 15 to 19-year-olds had 31 cases. 20 to 24-year-olds had 85 cases. Again, those are for women or females in Texas 10 to 24 in 2017. Why young people? More times than not, youth and young people are overlooked in many areas as it relates to health. We always see prevention programs for children, adults, or the geriatric population. However, we rarely see any prevention programs for youth or adolescents or young people as it relates to health. Youth with HIV are the less likely of any age group to be linked to care in a timely manner and have a suppressed viral load. Young people were less likely to be aware of their infection compared to any other age group. People who do not know they have HIV cannot take advantage of HIV care and treatment and may unknowingly pass HIV to others. Nationwide, 46% of all sexually active high school students did not use a condom last time they had sexual intercourse. And to elaborate more on that, according to the CDC, addressing HIV in youth requires that young people are provided the tools they need to reduce their risk, make healthy decisions, and get treatment and care if needed. Also, condom use. Condom use among sexually active students decreased from 62% in 2007 to 54% in 2017, presenting a serious health risk for HIV as discussed in the background information. Thirdly, the more sexual partners one have, the more likely they're likely to have sex with someone who has HIV and does not know it. Again, why young people? They account for low rates of HIV testing, low rates of condom usage, and a high rate of number of partners. And again, as I said, the more sexual partners one may have, the more likely they are to have sex with someone who may have HIV and do not know their status. The ecological perspective. Ecological models specify that factors at multiple levels, often including interpersonal, organizational, community, and public policy levels, can influence health behaviors, although the relative influence may vary by target behavior or context. Human behavior is shaped by multiple levels of influence. Again, that are two definitions of the ecological perspective that I found would be acceptable for this presentation. Intrapersonal, meaning the individual. And I like this picture because it says existing or occurring within the self or within one's mind. So knowledge, attitude, belief, thing that relates to the individual. Friends for interpersonal, family for interpersonal, and then community. On the intrapersonal level, again, this is the individual. You have monogamy, so the youth or the teen is only having sex with one partner. They're educated on HIV, on the transmission of HIV. They use condoms if they're not in a monogamous relationship and they do decide to have more than one sexual partner. They're protecting themselves by using condoms. They know their status. They're getting tested as they should, and then they're not engaging in sex under the influence of any substance. And this is how we can prevent HIV transmission using the ecological framework on the intrapersonal level. Interpersonal level, again, that's like our family, our friends, our partner, our social groups. Those individuals can encourage the teen or youth to encourage them to do protected sex, having a conversation about HIV. Oftentimes there's a stigma attached to those three letters HIV, so many parents, friends, teachers, associates, partners don't want to have that conversation about HIV. Therefore, the teen is uneducated on how it is transmitted and how it can be prevented. Also, these individuals can encourage HIV testing to the adolescent or to the young person. Ecological framework on a community level. And in this sense, community is in regards to the policy, local, state, and federal policies or laws that regulate or support healthy actions and practices for disease prevention, early detection, control, and management. So, again, that's the public policy or laws, state laws, local laws. And what that can do is sexual health as a core course. I remember when I was in high school, health was required to graduate. Now in the state of Texas, health is not a required course. Therefore, youth and young adults are not getting that information in school, and sadly, they're not getting that information at home. The community can pass out free condoms for those youth who are engaging in sex. Also, routine HIV testing with healthcare providers. For the youth who are going to medical care, their providers should suggest an opt-out opportunity for where the teen can get routinely tested for HIV every year they come in for their checkup. Encouraging the teen to know their status. Community prevention education programs. That can be prevention programs, whether it be health-related or sexual health-related, just presenting that information to the teens so they'll be equipped with the knowledge to make better decisions as it relates to sexual health. And then free outreach testing for HIV, whether it be testing blinks, coming to the apartments, coming to local recreation centers where teenagers hang out, going to school, wherever the youth may be, having an outreach team go out and test those youth for HIV. Again, schools are in a unique position to help prevent HIV because many of times most kids spend most of their day at school. So having that information presented at school would be a great way to help reduce HIV as well as increase the knowledge of sexual transmitted infections, including HIV. So some takeaways. The importance of sexual health education taught within Texas schools. Making the conversation about HIV more prevalent among youth on an interpersonal and community level. So that means the community is talking about HIV as well as the family and peers and partners are talking about HIV. The importance of prevention methods of sexual transmitted infections among young people. Meaning using condoms, getting tested, you only having one sexual partner is another way that we can prevent HIV among youth in the state of Texas.